Did you know approximately 130 people take their own lives each day? We can help prevent suicide by learning how to help someone who is in crisis. Our center is a proud sponsor of the Helping Someone in Crisis campaign. For each individual that watches this video, our center will donate to a local suicide prevention advocacy group. We can save more lives together during Suicide Awareness Month and beyond. This is not a program for someone seeking help for suicidal thoughts. If you are thinking about suicide, about taking your life, we ask you immediately call the suicide prevention hotline number listed here. This short video will provide essential information to help someone in our community who may be suicidal. It is based on the recommendations from the National Suicide Prevention Lifeline. We're committed to this life-saving campaign. But it all starts with education and awareness to better understand how to help someone in crisis. Let's begin. Each of us should understand the risk factors and warning signs that help determine if someone is at risk for suicide. We will send you the full list after the video, but let's review several for you to gain a sense of their impact. Risk factors can include feelings of hopelessness, loss of a job or relationship, a sense of isolation, and alcohol and other substance use disorders, to name a few. Warning signs of those considering suicide can include talking about wanting to die or to kill themselves, or talking about being a burden to others. You will receive this list, and we encourage you to review it in more detail and discuss it with others to help spread awareness that could save a life. So, what do you do if you're concerned that someone will take their life? Fortunately, the Suicide Prevention Lifeline's 5 action steps are evidence-informed and the standard used to keep someone safe. The first step is to ask the question, are you considering killing yourself? This question may be uncomfortable for many, but research shows people who are having thoughts of suicide feel relief when someone asks this question in a caring way. Findings suggest acknowledging and talking about suicide may reduce suicidal thoughts. The second step is to keep them safe. Don't leave their side or end the phone call. You may even consider bringing the individual to the emergency room or to call 911 or a suicide crisis hotline in your efforts to keep them safe. Step 3, be there. Individuals are more likely to feel less depressed, less suicidal, less overwhelmed, and more hopeful after speaking to someone who listens without judgment. Step 4, help them connect. Be sure they know and use a network of resources and individuals for support and safety. This support can help them take positive actions and reduce feelings of hopelessness. And step 5, follow up. Studies have also shown that ongoing contact may be an essential part of suicide prevention, especially for individuals after they've been discharged from hospitals or care services. So now you understand the risk factors and warning signs that will help you to identify those who may be in crisis. You also learned about the 5 action steps for communicating with someone who may be suicidal. We now invite you to acknowledge your participation in helping someone in crisis by completing the below acknowledgement form. For every individual that acknowledges watching this video, our center will donate to a suicide prevention advocacy group. Every contribution helps to give back to our community